Thank you. Good evening, everyone. My name is Artie Hill, and I'm a member of the Hartford Alumni chapter of Delta Sigma Theta Sorority Incorporated. And I'm a passionate blood donor. I have on today my 5-gallon pin that just came in the mail last week. And I'm super passionate about this topic, and so are our panelists tonight, our guests. And we just want to share more information with you so that you can be more informed and be able to spread the word in our communities about the importance of blood donor diversity. So, as we get started, I just want to do a few acknowledgments. Um, I would like to thank from the bottom of my heart the partnering organizations for our webinar this evening. They happen to also be co-sponsors for the Juneteenth blood drive that we're having. How crazy is it? Next month already will be June. But I want to, of course, thank the Hartford Alumni chapter of Delta Sigma Theta Sorority Incorporated, Epsilon, Omicron, Omega chapter of Alpha Kappa, Alpha Sorority Incorporated, Farmington Valley, Connecticut chapter of the Links Incorporated, Greater Hartford chapter of the Links Incorporated, Theta Alpha Sigma Alumni chapter of Sigma Gamma Rho Sorority Incorporated, and last but not least, Phi Delta Zeta chapter of Zeta Phi Beta Sorority Incorporated. I want to thank these women-led organizations for saying yes to being partners for first the blood drive, which this will be our third year for the Juneteenth blood drive. But then this year, we wanted to add this extra element of having a webinar with experts in the topics of sickle cell and of knowing whether you are a carrier of that, and then also having a testimony from someone who is a carrier. And then, just having someone represented here from the American Red Cross to just give us some more information so that we can dispel all the myths and hopefully allay any fears that you may have about donating blood. And obviously, we know that sometimes you may not be in a position to donate blood, but if you can be more informed and then you can go out and ask others to do so, because we never know when we may be in need of blood. So I want to thank you so much for taking the time to join us tonight. Let me just explain the format. We have 4 panelists, and as we talk with them one-on-one, they're going to drop off, so you'll just see me and the panelists. I have a few questions for them. You'll be able to ask any questions in the chat, and then we'll also at the end we'll have Q&A where you can unmute and ask any questions that you might have of them. But I want to introduce the panelists. Dr. Baree Andamariam is a hematologist and founding director of the New England Sickle Cell Institute at the University of Connecticut Health Center. NESCI was established in 2009 and now serves nearly 300 adults living with sickle cell disease. And with a staff of 12 individuals, including nurses, social workers, patient navigators, and research assistants, NESCI provides comprehensive care, acute pain management, specialized blood transfusions, and a destination for children in Connecticut who have aged out of pediatric SCD care. Dr. Andamariam's research focuses on developing new pathways of care that improve SCD care quality, as well as translational research on deciphering the interplay between red blood cell adhesion to the walls of the circulatory system and the development of pain. She holds an undergraduate degree in molecular biology from Princeton and a medical degree from Tufts. She's also the chief medical officer of the Sickle Cell Disease Association of America, Incorporated. So thank you, Dr. Andamariam, for joining us tonight. We have Dr. Lenora S. Williams. She's an obstetrician and gynecologist with over 25 years of experience in OBGYN care. She is a North American Menopausal Society certified menopause practitioner. We might have to have her on for another conversation. I know some of y'all just had a conversation about that, but that's a whole thing. She is affiliated with UConn John Dempsey Hospital and Rockville General Hospital UConn Health. She received a BA in biology and music from Wesleyan, um, MA in Liberal Studies from Wesleyan, and her MD from the UConn School of Medicine. She did a residency there as well. So she specializes in OBGYN care, but she told me she's very passionate about encouraging everyone to find out their status of whether or not they are sickle cell carriers during preconception counseling. So we're going to talk to her a little bit about that. Tashonda Harrison is someone I met fairly recently, and we just have hit it off. She has been employed with the American Red Cross for almost 18 years. She started as a phlebotomist taking blood at the blood drives, but now she's a supervisor overseeing the drives. But she's very passionate about educating our community about the importance of donor diversity. And so she was doing this on her own time, just going to festivals and talking to people and coming to blood drives she wasn't even assigned to kind of help out. And then I'd like to say I had a hand in it, but we were like, this needs to be somebody's job for real. And so she is now the sickle cell community liaison in the Hartford area, and she's charged with recruiting Black and African American and Hispanic donors to make sure that we have diverse blood in our blood bank here. So thank you so much, Tashonda, for joining. And then Candace Donaldson is going to join us and talk to us about her experience as a carrier of the sickle cell trait, but also she had two siblings that passed from the disease, and she's going to talk about her experience. And she's also going to do a blood drive in their honor in September, which happens to be National Sickle Cell Month, Awareness Month. So lots of things we want to talk about and lots of things to get to. So let's get it started. We're going to start with Dr. Andamariam. And if you would just unmute and let's chat.
Sure.
You are a hematologist oncologist, and you've dedicated your career to sickle cell disease. And I'd like to help our audience understand the basics of this disease and the condition and its prevalence in our community. Could you explain in layman's terms for us what is sickle cell disease and how it affects patients?
Okay, thank you. Well, first of all, I want to thank you, Artie, and all the organizers for bringing this to attention in this format tonight. Thank you so much. So what is sickle cell disease? So sickle cell disease is a blood disorder. It's something that it's inherited. So you're born with it. It's not something that you catch. I've heard that before. People are like, oh yeah, I had that. I got over it. No, that's not what it is. Not like the flu. It's something that you're born with. It affects the red blood cells. And if we think about blood, what is blood? So blood is primarily made of red blood cells. And the sole purpose of our red blood cells is to carry around oxygen and deliver it to all of our organs as the blood passes through our blood flow. And delivering that oxygen allows all of our organs to carry out their essential functions. So the red cell is really where life, the ability of life to occur begins, in my opinion. Every specialist thinks their organ is the most important. So we hematologists think the blood is most important. So in someone who has sickle cell disease, there's something different about their red blood cells. And what's different about their red blood cells is what's inside of the red blood cells, what carries the oxygen. It's a molecule called hemoglobin. So red blood cells are really just big bags filled with hemoglobin. And it's those hemoglobin molecules inside of the red blood cells that are responsible for binding the oxygen when the red blood cells go through the lungs. That's where all the oxygen is. And then as the red blood cells leave the lungs and go throughout the body, those same red cells deliver oxygen to the tissues, and they do that in a cycle, round and round. So as we breathe in oxygen, we give oxygen to our red cells, they pass through the lungs, and they keep doing that. And they survive for about 3 to 4 months. These red blood cells are working that hard for about 3 to 4 months. So that's the typical person without sickle cell disease, that's what their red cells do. If you're born with sickle cell disease, there's a change in that molecule called hemoglobin. So it's different. You have the same amount, but it's different. And when the red blood cells release the oxygen. Instead of being able to completely circulate still, they change shape and they become like a crescent moon, or like a sickle shape, which is like a field tool. So that half moon shape is what they change into, and they're rigid. And so they get stuck in the circulation and they block blood flow. And when you block blood flow, you create a lack of oxygen, you create pain. And this pain that they develop is intermittent, it's severe. It comes out of nowhere, and that's due to the blockages of these red blood cells. The red cells are also fragile, so they don't live for 3 to 4 months in circulation. So that means that people with sickle cell disease, not only do they have blockages to blood flow, but they also have less red blood cells because they don't live as long. And that's why the disorder is called sickle cell anemia, because people are very anemic. So the average person with sickle cell disease has about half the number of red blood cells that the typical person without sickle cell disease has. So
And
it can
that's
cause.
why they need so many transfusions, and that's why
Yes.
the blood is so important for those particular patients.
Yes, they need transfusions for many reasons, and part of that is the anemia. So not everybody with sickle cell disease gets transfusions, but a significant proportion does. So I have 3 to almost 400 patients with sickle cell disease now, and just my center alone is responsible for consuming about 4,000 units of blood a year. We're the #1 utilizer of blood. Our condition, sickle cell disease at UConn Health Center, is the #1 condition for which blood is ordered and transfused. So it's an enormous amount of blood that people with sickle cell disease need.
Well, Dr. Andamariam, why is sickle cell disease particularly prevalent in the Black community?
Okay. So the risk of having sickle cell disease is about, well, sickle cell trait, that is about 1 in every 12 persons of African descent. So that's the risk of having sickle cell trait, which we'll get into, which is just the carrier state. In terms of sickle cell disease, there's a 1 in 365 chance, one in every 365 births in America of African Americans or people of African descent gives rise to a baby with sickle cell disease on average. So if you say there are 400 births, 400 births of Black babies, about 1 of them on average is going to have sickle cell disease in our country. Okay. So why is that? Why is it that the Black community is most commonly affected, not only in the US, but in the world? And that is because having sickle cell trait, which is just the carrier state, it's not having sickle cell disease, but it's being a carrier, and meaning that you're at risk for having a baby potentially with sickle cell disease. Having sickle cell trait is an evolutionary, it's a protective mechanism against malaria infection. So malaria is a severe parasitic infection that is most common in tropical areas of the world, particularly in Africa. And if you get malaria, particularly as a child, you have a very high chance of dying. So sickle cell trait actually has protected African babies from dying of malaria, okay, which means that they have the higher likelihood of living to adulthood and then having their own children, which means that the sickle cell trait gene is enriched in those who reach reproductive age. So it was evolved as, we believe, a protective mechanism to keep people from dying from malaria, but there's the risk of having sickle cell trait and then having a baby with sickle cell disease, which can have a lot of complications, including death at a young age and a lot of organ damage.
So I think you kind of answered a little bit of my next one, but you might want to expound on it a little bit. So the question is, what is the difference between having sickle cell disease and having sickle cell trait, being a carrier of the trait?
Okay.
I think what I hear you saying is the trait means that you tell me. I
Okay.
think I heard you mean
So,
it's protective.
so again, 1 in 12 people in this country of African descent, whether it's directly from Africa, African American, Caribbean, are probably have sickle cell trait and don't know it. And most people who have sickle cell trait in this country are walking around and they don't know it. Having sickle cell trait, okay, let's back up. So how do you, okay, so remember I told you sickle cell affects that molecule called hemoglobin? So in order for us to make hemoglobin, we need two genes. And one gene comes from our mom and one gene comes from our dad. That's how we make our hemoglobin. We need a gene from each parent. And if you have sickle cell trait, you got an abnormal hemoglobin gene from one parent, but the other parent's was normal. So you equal basically you look normal, your lifespan is normal, but you carry it and you don't know. You're not anemic, you don't have pain. But if you were a person who inherited a sickle cell gene from one parent and a sickle cell gene from another parent, you would have sickle cell disease. Does that make sense? I hope I'm making it
Yes.
clear. Okay. And you would generally know if you had sickle cell disease if you live in the United States and you're born. Let's take Connecticut, for example. Connecticut started screening all babies for sickle cell disease, no matter what color or ethnicity. All babies for sickle cell disease started being screened in the early 1990s. So if you were born in Connecticut from 1991 onward, you would have been diagnosed as a newborn. But I still see full-fledged adults, older adults, who didn't know that they had sickle cell disease and they don't find out until they're in their 60s or 70s. Unusual, but it does happen. Happens less and less now that all babies are screened across the United States at birth. So you got to know your status. And one more thing I wanted to say on that, I don't want to take too much time, but there are other traits that affect hemoglobin that if they're paired together with sickle cell trait, so say you get sickle cell trait from one parent and another type of hemoglobin trait like C trait, thalassemia trait, that can give rise to a sickle cell disease like condition. Okay, so it's not just about knowing whether or not you have sickle cell trait when you're thinking about reproduction and risk to your children, but it's also knowing whether or not you have one of these other more rare but significant hemoglobin traits. So it's not enough. It's important to know your sickle cell trait status, but you also need to know about these other hemoglobin traits. But Dr. Williams will get into that further.
Okay. So just a couple of more questions. How does diversity in the blood supply directly impact patients with sickle cell disease? Why is that important?
Yeah, that's okay. So people think that blood typing is all we need to do in order to match a donor to a recipient. So meaning all we need to know is whether or not someone's A positive or B positive or O negative. And that's all you need to do when you're trying to match a unit of blood that's been donated by somebody and give it to someone who's in need. Okay. There are these other smaller letters that represent really complicated things about our red cells, okay? That 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 people can develop resistance to if they're exposed to blood from a donor that has these other little letters of the alphabet that sort of characterize their red blood cells, okay? So let me give you one, for example. Beyond being A positive, B positive, O negative, there's another type of letter that's important that characterizes somebody's red blood cells, like big C. And we know, for example, that most people of African origin don't have big C on their red blood cells. Okay. So if you give somebody with sickle cell disease, who's most likely of African descent, who most likely does not have big C on their red blood cells, and you give them blood from someone who's not Black, more likely than not, that blood comes from a donor whose red blood cells have big C. So what does the person with sickle cell disease do? They see their body gets that blood, they see that blood, and they're like, wait. This is not supposed to be in my body. I don't like this. I don't know what this big C on this red blood cell is doing in my body. It's foreign. So the body reacts to it by developing an antibody. It's usually not a big thing to the patient during that transfusion. They might get a little fever, might not feel that great, but usually it's just an antibody. That's it. But that means forever and ever and ever, they can never, ever receive blood from a donor who has that big C on their red blood cells, or they can have a severe life-threatening reaction to it. So what does that mean? So it's better to only expose people with sickle cell disease, who are majority of African descent, to blood that has an alphabet soup on it that looks as much like their own red blood cells as possible, because you can get to the point where you have so many of these antibodies develop that there's not any compatible blood donor across this country that can match them, and that can be life-threatening.
Okay, so that we're going to get into a little bit more of that donor diversity and importance of that when we talk with Tashonda.
Okay.
But thank you so much for leading us into that. And I learned a lot more than I knew. So thank you so much for sharing that. And we may have more questions for you later. But let's move over to Dr. Lenore S. Williams, and she works with many families in our community who have unique insights into how carrier status impacts, family planning and reproductive health decisions. And so we want to talk with her a little bit about that. Dr. Williams, thank you so much again for joining us this evening. How can individuals discover if they're carriers for sickle cell trait or other genetic conditions, like Dr. Andemariam was talking about? How do we find out what we have?
I'd like to thank you for inviting me to do this. I'm very passionate about this, and this is a very, very important healthcare topic. So, how do individuals find out whether or not they are carriers? As Dr. Andemariam mentioned before, that all newborns in the U.S. are screened for not only for sickle cell disease or sickle cell trait, but other genetic diseases. One of the problems with that is that once you find out that your child does not have and we're talking about sickle cell, does not have sickle cell disease, you may not be aware, or it may not register with you, that while your child does not have sickle cell disease, your child may have sickle cell trait. And as a newborn, as a 5-year-old, as a 10-year-old, as a 13-year-old, it may not be all that relevant, and it may not be top of mind to you. But as folks approach the age where they are reproducing, it is important. And what happens is somehow that information that is provided to parents when their children are newborns is not disseminated to these kids and young adults, so that they often are not equipped with that information regarding their sickle cell carrier status. Somewhere along the line, that information is not conveyed. I know most of the patients that I see who would be at risk for having sickle cell trait, first of all, are not very aware of what sickle cell disease is, and certainly are not aware of their sickle cell trait status. So one of the ways that we are tested, that people can find out, is to query their pediatricians, their family doctors, so that they can get that information. Also, as an OBGYN, I'm in a unique position to offer screening to determine carrier status to the patients that I see. And because of a bullet that I dodged with my latest grandbaby, I have taken this on as my little mini crusade. So I ask all patients who look like me and look like my son and look like my daughter-in-law, and I won't make you look at a picture of my grandbaby, but look like my grandbaby. I ask them, do you know about sickle cell disease? And do you know your sickle cell status? And, I'm not a hematologist, but the very least I can do is when they're coming in for their routine GYN visits is to offer them a hemoglobin electrophoresis test. And that's a simple blood test that will, and Dr. Endemariam can talk more about it, but it can tell us whether or not you have normal hemoglobin and whether or not you have hemoglobin that is sickled, whether you have some of the other types of abnormal hemoglobins, and that is a start. Also, patients can be referred to genetic counselors for genetic testing, and often when you refer to a genetic counselor, they're not necessarily just going to test for sickle cell. There may be other diseases that would be beneficial for you to know based on your family history, whether or not you should be tested for those things. And touching on family history, we as a people need to be more open about what types of diseases we have in our families. We have tended to be very private about those things, but it is vitally important that we know and that our children know, what Auntie Nene had, or what Uncle John had in terms of diseases. So patients can be referred to genetic counselors, and this way they can determine what additional diseases or genetic diseases should be screened for. Am I back? Another thing that is important is preconception testing and preconception screening. We really need to plan for our pregnancies, and we need to plan for our pregnancies months ahead in terms of lifestyle changes, getting rid of any bad habits, making sure that any underlying chronic illnesses that we have are under control, but more importantly, to find out, what runs in our families and get tested ideally before conception. And again, sitting down with a genetic counselor can allow us to do that. So those are the main ways that you can get tested, either genetic testing or just a simple hemoglobinopathy. And I have been discussing with some of my primary care colleagues the importance of offering this testing to people who look like me when they come in for their visits.
Awesome. Thank you. Beyond sickle cell, because I think Dr. Andemariam touched on it a little bit, and I think you have too. What other genetic conditions disproportionately affect Black and Brown communities that we should be aware of? Since we have you on here, what should we know?
In terms of genetic diseases?
Yeah.
So, it may not so much be that we are disproportionately affected,
Right.
but it is more that some of these other diseases, like for example, Tay-Sachs disease. We typically think of Tay-Sachs as being a disease that Ashkenazi Jews are affected by, but there are certain people of African descent, French Canadian, and Louisiana Creole, who may be affected by Tay-Sachs disease. And often we are not offered that testing. Also, cystic fibrosis, which is thought of again as a disease that is of the white population, but it is underdiagnosed in Latino and Black populations. Also, there are different types of thalassemia, alpha thalassemia, beta thalassemia, that are more common in people of African descent and Southeast Asian descent and Mediterranean descent. And Dr. Andamariam can talk a little bit more about that. But these are some of the things that we may not ordinarily be offered testing for. Again, because of some of the healthcare disparities that we know exist. And most of us are aware of the BRCA1 and BRCA2 genes, but the sad reality is that most Black women and Latinx women are not offered testing for this as frequently as our white counterparts, even when it is indicated.
Okay. So thank you for sharing that. We're gonna bring you back in at the end for the Q&A part because I know that there are going to be some questions that we have that you would be very helpful in answering. Let's move on to Shonda, who is coming to us from the blood drive perspective with the American Red Cross, and have her give us some information about I do want to actually want you to share with everyone about this Power Red too. But why is there, I think we, touched on it a little bit with Dr. Andamariam, why there's a specific need for blood donations from Black and Brown donors. And do you have the number, the percentage in the top of your head about, nationally and maybe in Connecticut, because the numbers that you see in terms of who is actually donating blood regularly?
So, Artie, I don't have the numbers off the top of my head, so I don't want to just throw out random numbers.
Yep.
I don't have the numbers for how many African Americans donate in Connecticut, but I can get that to you at a later time.
Yeah, no problem. I do think that I heard from the Red Cross that 3% of the donors in the country happen to be of Black and Brown descent.
Sounds
And
about right.
so, yeah. And so we are trying to move that needle because as we, learned from Dr. Andamariam, it's really important that the blood that's closest to the needs for sickle cell patients is the best for them. And unfortunately, if we don't have enough of us donating blood, that means that they don't have enough of that specific blood type to be able to give to donors during to give to patients during transfusions. Is that correct?
That is correct. That is correct.
So what are some common misconceptions about blood donation in our communities? What do you hear out there as from people about why they don't donate blood?
So I hear a lot of things, and it's funny because even when me and you were recruiting and people were walking by, they were we were trying to get them, and they're saying, "Oh, I can't donate blood because I have high blood pressure, or I take high blood pressure medications, or I have low iron." When you and I were out there, that's what we heard a lot. Some of the misconceptions could be also just historical events, historical factors that kind of create barriers for for us to get out there and donate. I think that's a big one as well. Some people are just scared of needles. The thing with the high blood pressure and the people that walk by our table very quickly, oh, I have low iron. We check for blood pressure, we check for hemoglobin. So we're going to make sure that your levels are correct and the levels that they should be before we just take your blood. Some people are scared of what they might find out. They might be scared to test. They'll rather not know what they have. I think that's out there as well. But a lot of it is just a fear of needles. Uh, I always get some people saying, "Well, what are you going to do with my blood when you get it?" We're going to give
Giving
it
us
to
a
a
lot.
patient in need. That's what we're going to do. So those are some of the common misconceptions.
So walk us through the blood donation process for someone who's never been before. And they're like, I've never donated blood. What is that going to look like? What does that mean? Walk us through that process and what they can expect.
All right. So first, before I walk you through, I do want to start off by saying we want you to eat a hearty meal. We want you to eat a meal. We don't want you to come because some people think that it's like fast, it's like blood work and they need to fast. So we do have people come in like, oh, I didn't eat. I thought I needed to fast. So we want you to eat a hearty meal before you come donate. We want you to be very hydrated. We want you to start a few days in advance hydrating with water and juices. Um, we want you to eat iron enriched foods, especially for us in our community, especially as women. I can't tell you how many times we come in to donate and we're ready to do a good thing, but our iron is low. So we need to start off a couple weeks in advance eating iron enriched foods. Green leafy vegetables is one, lentils, uh, beans, stuff like that, just to name a few. Start eating your iron enriched foods. Come in with, and I hear you say this at a lot of blood drives, warm your fingers up. Warm your
Yes,
fingers up
yes, I got
because
that too.
we're going to be checking your hemoglobin. And we do have a new way to check hemoglobin. I want to throw that out there as well. It's not a finger stick. So people are going to get excited about that because a lot of people hate the finger stick. So coming into a blood drive as a first time donor, you're going to register, you're going to check in, you're
You're
going
gonna
to
bring
sit
your
down,
ID.
you're going to bring your ID. Uh, you're going to check in, you're going to read the materials, what you must know, everything about donating blood. From there, you are going to go over to a health history. We are going to do like a mini physical findings. It's going to consist of your height and weight. We're going to check your hemoglobin, pulse, blood pressure, things of that nature, your temperature. From there, we're going to ask you a few questions, kind of lifestyle questions about medications, of travel, things like that. Once you pass that, you're going to go over to the donor chair, donor bed, whatever you want to call it. We're going to set up for you to donate blood. The donation process itself is around 5 to 10 minutes. It's everything else that take
Especially if you're
longer,
hydrated.
especially if you're hydrated. So we always tell people the whole process is about an hour from start to finish. Could be a little more, a lot of times it's a little less. But you're going to donate. It's going to be 5 to 10 minutes. We're going to take about a pint of blood. You're going to finish. We're going to disconnect you. Make sure you're feeling well, with which most people are. We're going to send you over to canteen for some hydration and some snacks, and then you're going to be on your way.
You'll get the Oreos, which are iron rich, everybody.
Yes,
Oreos
yes,
have
yes.
are high in
Yep,
iron. So you
yep.
can eat that before too. And tell us about the Power Red that is happening now.
So the Power Reds, we had them years ago and then it went away for a little bit and now it's back. Came back in October and the donors love it. So instead of you donating 1 unit of blood, you can donate two. Well, 2 units of red cells. And we give you back your platelets and your plasma. It takes a little bit longer, but it's more beneficial because a person that needs blood, it's better for them to get the 2 units from the same person than get multiple units from different people. It's less complications that way. So you'll be donating 2 units of red cells. We
Okay.
give you back also, let me just throw in there, we also give you back on top of your platelets and plasma, we add in their saline. So the saline hydrates you as well. So a lot of people feel better after they donate the Power Reds. And instead of you donating every 56 days, it's pushed off to 112 days because you gave the 2 units. So that helps some people as well, especially people with limited time.
Okay. So you can donate Power Red at Juneteenth, but you may not be eligible to donate again in September at Candace's blood drive, but perhaps you'll be ready in November for the Qs.
Yeah, because you got to wait the 112 days.
Okay. So how can people determine if they're eligible to donate, particularly if they have sickle cell trait?
So people with sickle cell trait can still donate. They're gonna be, they have the same requirements as everybody else. They can call the Red Cross if they have any questions, because they'll give you the most up-to-date information on that. Or they can go online to redcrossblood.org.
Awesome. Thank you so much. So you stick around as well, because I did see a question in the chat, and we'll make sure that we get that answered. And if you have any other questions, audience, please do put it in the chat, and you'll be able to ask just a minute. But I want to get to Candace Donaldson, who is going to share. Thank you so much, Shonda, who's going to share her personal testimony um, about her experience with sickle cell. So Candace is both a carrier of the sickle cell trait and has experienced the devastating impact of this disease through the loss of her two siblings. And she plans to honor, as I mentioned before, their lives and help others by hosting a blood drive in September, which is National Sickle Cell Awareness Month. So Candace, thank you so much for reaching out to me about your passion for helping others with this. And I would like for you to just share with us, as much as you would like to, your family's journey with sickle cell disease, so people can understand the importance of why we need to donate blood to help sickle cell patients.
Thank you, Artie.
You're
Yes, so sickle cell disease has had a profound impact on my family. Both my older brother and sister were carriers of sickle cell disease, and sadly passed away from complications related to it. Their journey was filled with moments of excruciating pain, strength, perseverance, and immense challenges, which has driven me to advocate for awareness and support others affected by sickle cell disease.
When and how did you discover that you were a carrier of the sickle cell trait?
I discovered I was a carrier for sickle cell trait in my late 20s. By the way, I'm only 25.
Okay, girl, you're looking good with the 25.
No, I'm in my 40s. I had been
Looking good.
experiencing unexplained body aches and pains, and so I decided to get a blood test. That's when I learned not only that I had anemia, but I carried the sickle cell trait as well. It was an eye-opening moment that helped me better understand my health and my family's history. So my siblings and I have the same mother. I'm the only one who have a different father.
Okay.
So they inherited the sickle cell disease, and I have the trait.
Okay. And how has knowing your carrier status impacted your health decisions?
Knowing my carrier status has definitely influenced my health decisions. I strive to make healthier choices. I like to eat a lot.
Don't we all?
But I just try to make sometimes, not gonna say all the time, just healthier choices and remain vigilant about managing symptoms like the fatigue and the pain. It's a constant reminder to take proactive steps for my well-being, even though it can be challenging, very challenging at times.
Okay. So what message would you like to share with our community about the importance of blood donation and knowing one's carrier status?
It's crucial for everyone, especially within the African American community, to know their carrier status. This knowledge will empower individuals to make informed health and family planning decisions, as everyone has mentioned prior to me speaking. Also, blood donations from our community, is very vital. Some sickle cell patients often need blood, well, not some, all sickle cell patients often need blood transfusions and donations from African American donors, and they can provide the most compatible match.
Yep.
It's within the African American community. So let's come together to support and save lives in our community. I know a few years back, I served as a volunteer for Citizens for Quality Sickle Cell Care. It was an organization located in New Britain. And I've also facilitated paint night fundraisers through my business, raising and donating over $1,000 for sickle cell warriors.
Thank you.
So I'm very excited to host a blood drive in honor of my sister and brother, and during Sickle Cell Awareness Month, which is in September.
Yes, yes. So I can't remember if I mentioned this before during this actual webinar or when we were chatting before we brought everybody in, but Candace is going to be at the Juneteenth event. We have been so successful, I believe. The American Red Cross has wanted to recruit more donors from the Black and Brown community for a while, and then the pandemic happened, and you know, all the things got thrown off and set back. But I came on board because Trina Williams with the Greater Hartford chapter of Jack and Jill Incorporated, they partner with the American Red Cross nationally and wanted to have a more robust Martin Luther King Day of Service. And so they decided to have a blood drive in addition to collecting canned goods. And from that, I was speaking with the Red Cross contact person at the time about how I wanted to help with the initiative of reaching more folks. And I know that it's really important for us to have these conversations with each other, because if someone, as we all know, we hear better when we are listening to people who have something in common with us, for better or for worse. But Candace, if you tell me your experience and you tell me that it's important for me to do a thing, I'm going to listen more to you because we look a little bit alike. So I think it was really important for us to partner with the Red Cross and let them know that when you're wanting to target certain communities, and especially because of the things that we know have happened in our communities in terms of experimentation without our will, that it's really important for us to have people that look like us sharing this information so that we can be a trusted resource to our community. So I thank you for that. And you're going to be at our Juneteenth event recruiting donors as they give blood there, when they're at the canteen having their iron-rich Oreos. You can have your laptop up and have them scheduled to give again, unless they're power red, give again at your blood drive in September. And so we've been really successful because I started doing that. You know, we have the blood drive in January with Jack and Jill. Then there's a church blood drive in March. And I was at the Jack and Jill one in January signing people up for March. In March, we were signing people up for Juneteenth, which gives us an opportunity to fill those slots up fast. And so I thank you for your desire to help us save lives and your personal testimony. Let's bring everybody back in the few minutes that we have left. I want to look at the chat to see what questions we might have from our participants. And pardon me while these glasses are not the best. I'm trying to look real crazy. So let's see. I'm getting up on my screen. I see a question. Shanae Walker asks, what if you're biracial? And Shanae, I don't know if you're still on and if you want to come on and specify, but when you mean what if you're biracial, do you mean might you have the sickle cell trait, or what was your question in terms of what if you're biracial?
So like what I basically meant is if you have like a Black mom and maybe she's a carrier, and if you have like a white dad, like would you pick up the trait, or would you be like diagnosed with the disease? Since you have two different, races of parents, since I know it comes primarily from the African American community.
Gotcha. Thank you. Dr. Andamariam, you want to tackle that one?
I am so glad you asked that question. This is really important. I have patients in my practice who are white. I have patients in my practice who are Indian. I have patients in my practice who are from Turkey. So even though, I'm so glad you asked this clarifying question, even though the people predominantly affected by sickle cell disease and the people who most commonly have sickle cell trait in this world are people whose origins are in Africa. Okay, so that looks like people in Africa It looks like people in the US of African ancestry, people in the Caribbean, people in South America, like Brazil. Those are the hot spots. But there are other parts of the world, like the Indian subcontinent, like all the Arab countries, like all the countries on either side of the Mediterranean Sea, whether that's the North African countries or the Southern European countries, where sickle cell disease exists in decent numbers. So even if you're biracial, you're at risk for carrying one of these hemoglobin traits, whether it's sickle cell trait or thalassemia trait. Again, the risk of having a baby with sickle cell disease doesn't matter whether you're a carrier of sickle cell trait or some other hemoglobin trait. That risk is still there, depending on who you have a baby with and what their hemoglobin looks like. So I have patients, Black patients with sickle cell disease, who have told me, oh, don't worry, my boyfriend's white. Or I'm not worried, Dr. Andamarian, because I have sickle cell disease and I know I'm never going to have a baby with sickle cell disease because I only date white guys. Literally, I hear this all the time. And I'm like, no, that is not putting you at less risk for having a baby with sickle cell disease. The other thing I commonly hear, and I'm sure Dr. Williams hears this all the time, oh, it doesn't run in my family. Oh, my husband, the trait doesn't run in their family. Well, I'm like, if I were you, I'd want to see it on paper. So I would tell him to go ahead and get his blood drawn, and let's just see exactly what that hemoglobin looks like, and then let's talk about it. You know, so this whole family history, trait doesn't run in my family, don't worry about it. We hear it all. And that, you know why we hear it all? Because we continue to have babies born with sickle cell disease, largely to people who did not know what their risk was.
It is so
Thank you.
important that prior to conceiving that you know your status. So, okay, so what do you do with that information? If you know prior to conceiving that your partner is a carrier for sickle cell trait and you are also a carrier for sickle cell trait, that means you have a 25% chance of having a baby affected by sickle cell. Those odds aren't bad if you want to win the lottery, but to having a baby with sickle cell disease, that's pretty significant. So what can you do about that? If you know ahead of time, you can use some of our reproductive technology, in vitro fertilization, where you can select out embryos and test them prior to implanting them back into the uterus to determine whether or not that embryo is going to be affected by sickle cell disease. And, you know, it is a much more favorable way to handle things rather than to have to find out that information during a pregnancy. And some people may be faced with a very difficult decision as to whether or not, if they find out by either chorionic villus sampling, which can be done between 10 and 13 weeks during a pregnancy, or amniocentesis between 15 and 20 weeks during a pregnancy, that their child has sickle cell disease. And the two last tests that I mentioned are diagnostic tests. They're not screening tests. And people may be forced with a decision to make regarding whether or not they choose to continue a pregnancy. So it's much more favorable to have that information before you conceive. And you may decide that you don't want to use any of those other those options, but at least you know in advance what you may be dealing with. So you might have a 25% chance of having a baby that has sickle cell, 25% chance of having a baby that is not a carrier nor has the disease, but a 50% chance of having children that are carriers. But the most important part of that is that if you and your partner are both carriers, you have a 25% chance of having a baby with sickle cell disease.
Wow. Thank you. That's such important information for us to know. And as I think about, okay, well, my babies are 23 and 22. like never even thought about, any of this. So we'll definitely be talking with them about all of it. We have a few more questions in the chat. We've got 5 minutes. This is so enriched. I see that Kara asks, is there a need for volunteers on June 19th? If so, how can we sign up? Kara, email me, please. And I did share it in the chat at bloodforusct@gmail.com. I created an email specifically for blood drives because I try to help out with these 5 specific ones where we recruit Black and blood donors throughout the year. And I just want to make sure that all that information goes in one place. Please email me there so I can have your information. And we'll find a place for you to help because there are so many people who are first-time donors, and they love to see friendly faces and cheerleaders, and you want to make sure that we have enough support. So please email, and we will figure out where you can help us. Monique asked, hi, Monique Daly, what is the waiting period for blood donation after traveling to certain regions?
So if you travel to malaria countries, you would have to wait 3 months from the date you came back from that you left that country. It's a lot of travel places that are fine. You could come right back the next day and donate. But if they're malaria risk, you would have to wait 3 months from the date you come back.
Okay, thank you, Tashonda. And speaking of malaria, I see the question about not sure if it was explained or asked already, why is the trait or disease so prevalent in the Black community? And Dr. Andamariam shared with us that it was, tell us again briefly, Dr. Andamariam, it was to help us not get malaria.
Exactly. So people born with sickle cell trait are much less likely to get really sick if they're exposed to malaria. Again, malaria comes from a mosquito bite in certain areas of the world, and particularly in Africa. And if you have sickle cell trait, you're less likely to get severe infection and die. You're more likely to grow up and have babies and pass along that sickle cell trait gene for generations and generations.
Thank you.
I just
I
wanted to make one other comment. As we all are organizing these blood drives, I think it would be a great idea if we also had information sessions and testing at our historically Black universities and colleges so that we make sure that all of those young people know their sickle cell trait status. And, I would love for all Black and brown folks to know before they graduate high school what their sickle cell status is.
That would be awesome. I'm going to ask our PRT team if you would drop, please, the link in the chat for our survey. Ooh, you are on it. Thank you. Because we want to make sure that we get some feedback from you as to how helpful this might have been. And I still see questions on here. I'm not sure if I'll be able to access these questions to be able to I don't know even how I would answer them because I don't have emails for everyone. But let's see if I don't know if we have time. We have 1 minute. I'm so sad about it because there are questions in here about any advancements that we've had in terms of blood donation and sickle cell, and people are sharing lots of information in the chat. As we close out, and I apologize that we're not going to be able to get to those because we said 7:30, and I just want to be respectful of people's time. I want to thank everyone again for joining us this evening, and thank especially the partners who have been with us on the Juneteenth recruitment side, helping us getting the donors for that for the last 3 years now. Hartford Alumnae chapter of Delta Sigma Theta Sorority Incorporated, Epsilon Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated, Farmington Valley Connecticut chapter of the Links, Greater Hartford chapter of the Links, Theta Alpha Sigma Alumni chapter of Sigma Gamma Rho Sorority, and Phi Delta Zeta chapter of Zeta Phi Beta Sorority. Thank you so much for helping me recruit donors for our Juneteenth blood drive. Thank you for sharing the information about this webinar on your social medias so that we were able to have people join us this evening. I want to thank the panelists for taking time out of their busy schedules to join us. Lots of really good information, and I hope that something that you heard here today, audience members, something you heard here today will encourage you to give blood, give back, and share this information with someone else so that we can each bring someone to the blood drive. How many lives can we save? A pint of blood saves 3 lives. So we want to just encourage us to do better, because if we don't save ourselves, who will? Okay. Thank you so much for joining us this evening, and God bless you.